present Amy Braddel, who's a genetic counsellor from Wessex. And she's done some research that is so timely because she's looked at the education needs required by cardiac nurses who are becoming involved in genetic testing. So over to you, Amy.
Thanks, Catherine. Hi, everyone. So I'm going to talk about this research that we've done exploring genomic education needs for inherited cardiac conditions nurses. So a bit of background. So obviously nurses represent the largest professional group within the NHS, so are crucial in supporting the successful integration of genomics into mainstream healthcare settings. And we know that ICC nurses are crucial for delivering ICC service care, and they use their cardiology background and additional genomics knowledge to bridge those services together, so cardiology and clinical genetics together. But at present, we know that ICC nurse competencies have not been formally defined, and education tends in genomics tends to kind of vary nationally within different centres. So this study aimed to explore those education needs and the support required for ICC nurses to fulfil their role in the current era of genomic medicine. So the method we used was a qualitative method. So ICC nurses were first of all given the opportunity to express their interest in taking part during a previous AICC conference and at a BHF study day. So we invited all of those who were interested in taking part, and they were all from various centres across the UK. And we had 8 respondents who took part in a semi-structured telephone interview. And those interviews were recorded, transcribed, and then coded and analysed using an inductive thematic analysis approach. And I think the mean length that the ICC nurses had been in their role was 4.9 years, and the range was from 1 to 12 years. So we had a range of fairly new ICC nurses and experienced ones too. So I'm going to talk through the main results from the study, and there were 4 major themes that we deduced from the thematic analysis. So theme 1 was transferable core competencies. Theme 2 was around managing genomic information. Theme 3 is around how best the nurses learned, and that was through mixed modality learning. And theme 4 was around defining role boundaries within the ICC MDT service. So theme 1 was transferable core competencies. So ICC nurses described how their strong foundation in cardiac nursing enables them to support symptomatic ICC patients to understand and manage their condition. So I've got a quote here from one of the participants. It says, "If they're newly diagnosed and we haven't even done genetic testing yet, they'll still come to me and we'll talk about, well, what do these symptoms mean and what do these medicines mean?" So it shows that their role goes beyond just talking about diagnostic genetic testing and actually helping patients to understand their condition as well in the clinic. And participants also discussed the impactful nature of ICCs, such as sudden cardiac death of an infant in families, and the importance of communication skills in those scenarios. And most of the participants expressed the desire for developing their counselling skills as well. Theme 2, managing genomic information. So managing uncertainty, and that uncertainty was kind of around uncertain results for USs, and also uncertainty about kind of when we have a genetic result, what's that going to mean on the phenotype? So managing uncertainty and facilitating sharing of that genomic information with families were identified as kind of new areas for training, areas that have had to be kind of developed as during their training. One of the quotes was, "And sometimes you get patients with established variants and then things change. You know, it can be very unsettling. So it's just, I guess, with the new things that are coming up, have we got enough skill?" And participants also highlighted the importance of increasing their genotype-phenotype knowledge to apply the context to the results for the family. So another quote, "I know with genetics and the phenotype, what might put someone at more risk, less risk, or arrhythmic risk." So the nurses are already, when they've kind of been more established in their role, have already been kind of applying that genotype-phenotype knowledge, and they identified that as being an important part of their role. Theme 3 looked at mixed modality learning. So the ICC nurses felt that their learning experience must be immersive, involving a combination of course-based and work-based learning, and as well support from peers was really important. So I think it's a combination of doing a course, having the opportunity to practically apply the knowledge from that, but then also networking and sharing of knowledge amongst colleagues. So it's really that whole combination, that immersive learning environment that the nurses felt was needed for their training and ongoing development. And they all felt strongly that a bespoke competency framework would be helpful for guiding their ongoing development. And as highlighted in this quote here, heart failure competencies don't cover it. Neither do general cardiology, and neither do genetic specific competencies. So, you know, we can draw from each, but it's a specialist area in its own right. So they really felt that there needed to be specific ICC related competencies. And the final theme was defining role boundaries. So the nurses in the study compared their role most often to that of a genetic counsellor, and kind of similarities and differences between the roles. So we know that there's a lot of overlap, but they also highlighted a lot of specialist skills that would not be fulfilled by a GC, and vice versa. So what's another quote here? When she got her positive genetic cascade result, I referred her to a GC, as I feel I haven't got those skills to be able to explore that properly, and the implications for her as a person, which I think is more of a counselling role. So that's talking about kind of predictive genetic testing there. And it was kind of expressed by the nurses in the study that actually certain elements, such as discussing the emotional impact of genetic results and impact on families, and thinking about reproductive options and things like that, were identified as more of a GC's role and beyond the scope of their practice. So this is to conclude. The ICC nurses in this study valued the opportunity to develop their skills through that immersive learning environment, and really having lots of support from their colleagues within the wider multidisciplinary team. They identified the need for further bespoke training on topics and issues relating to ICC specifically, such as managing uncertainty and developing genotype-phenotype knowledge. And a competency framework could help to differentiate between what ICC nurses need to know and what they need to be able to practically apply. And there could be kind of different levels within that competency framework, which I know has been kind of something that's in kind of discussion by Health Education England at the moment, in terms of developing competency frameworks for mainstream clinicians, and having different levels of competencies will help to kind of aid development and expand the role. And so, you know, this competency framework may also subsequently help to define role boundaries within the ICC services and utilise skills from the different professional groups within the ICC service to improve quality and care for patients and families. And just to kind of finish, we're thinking about the life journey today of ICCs, and it's been highlighted through this study that ICC nurses have a unique skill set for supporting symptomatic patients with an ICC, and GCs are genetic counsellors are highly trained in those skills needed to explore predictive genetic testing with patients. So it might be that's kind of a way to delineate the roles, and ICC nurses perhaps have the skills for diagnostic genomic testing, and GCs have kind of better apply their skills in predictive genetic testing situations. And these are just my acknowledgements. So thank you to everyone here, especially the ICC nurses who kindly participated in this research. We wouldn't have been able to do it without them. Thank you.
Fantastic. Thank you, Amy, for again a very comprehensive walk through our kind of the auditing. I mean, it's you highlight a really valuable point that, you know, the whole of the multidisciplinary team plays a fundamental aspect of ICC services, and we've got to work towards ensuring that everyone is engaged and to support training and education across the board. So thank you, and thank you also to the rest of our speakers too, who kept very eloquently to time. So now we can open